Well, here is the latest on India's COVID trajectory. Active cases have declined for the fourth day in a row and stand a little above 3,300 as of early this morning. The overall change in COVID cases in the last 24 hours stands at 163. The recovery rate is still above 98%. Vaccination rates have also steadily risen in the last 4 days. Over 87,700 people have been inoculated in the last 24 hours. Prime Minister Modi chaired a high-level meeting to decode the COVID situation yesterday. We learned from government sources that hospitals are organising mock drills covering all aspects of treatment to ensure readiness in case India does see a rise in COVID cases. However, the government has reiterated there is no reason to panic. It has also said it's keeping a close eye on the situation in China. Meanwhile, the Civil Aviation Ministry plans to restart random testing of international passengers who will arrive in India from the 24th of December. 2% of arrivals would undergo testing. Our team of reporters gets us more on the government's COVID vigilance plan.
Government sources have informed that approval has been granted to COVID's nasal vaccine, and the option to take the vaccine is likely to be introduced on CoWIN app today. Centre is carefully watching the COVID situation in China and has taken note of the rising number of cases in the neighbouring country. On December 27, hospitals across India are slated to conduct a mock drill to ensure operational readiness for COVID treatment. The Union Health Minister and State Health Ministers will remain present at various hospitals during the mock drill, which will cover all aspects of COVID treatment, right from admission of patients to administering of oxygen and medicines. The Union Health Minister is scheduled to meet IMA representatives and other stakeholders from the healthcare sector on December 26, even as an ICMR study is underway to examine if there is any link between COVID vaccines and death due to cardiac arrest.
Well, the government will start random COVID testing of international passengers arriving in India from December 24th, 10 a.m. onwards. 2% of the international passengers will be randomly selected by the airline crew, and those samples that are found to be positive, they will be further sent for genome sequencing. The government has instructed the airports to ensure that the required infrastructure for random COVID testing of international passengers is set up well in advance. The government has instructed that whenever the deboarding happens, there should be proper physical distancing. Those passengers that are showing any COVID symptoms should be isolated in flight. And the government has also further said that whichever passengers that are arriving in India, airlines must try to ensure that they're vaccinated as per the protocol of vaccination in their respective countries. So all in all, if we see, the central government has issued clear guidelines for international passengers that are arriving in India. And this step is a major step by the Union Aviation Ministry as well as by the Union Health Ministry.
Well, as of now, I am picking up mixed feedback from hospitals. Hospitals, in fact, at this point in time, have a varying amount of vaccine inventory, with some having a limited amount of inventory to some possibly having more expired inventory. Now, what I am picking up is that the procurement going forward will depend on, say, for example, any new government mandates which have come out with regards to vaccination and how one should proceed. And separately, in terms of new vaccines such as the nasal vaccine, it will entirely depend on factors such as demand, again, in terms of any kind of government mandate. Lastly, some hospitals are seeing a spike in booster shots in the past 2 weeks. So they are seeing what they have described as a J-curve when it comes to booster shots and COVID-19 vaccines. But in terms of inventory, yes, they do have enough. Will they be getting much more? It will depend on how demand takes off.
Ekta, many thanks. And as we pointed out, the government has cleared Bharat Biotech's intranasal COVID vaccine as well. But we expect that to be rolled out in the private hospitals to start with. At this point in time, no fresh orders being placed for vaccines either by the government or by the private sector. As we've been pointing out, please do not go by unverified WhatsApp forwards, WhatsApp messages. There is no evidence at this point in time to show that there is any surge in India or that the variants that are currently in play in China are deadlier than the Omicron virus. And remember, both these variants have been in India for the last few months. The big global story: the committee probing the riots on US Capitol Hill on the 6th of January 2021 released its final report, declared that the central cause of the attack was one man, and that is Donald Trump. Also recommended barring the former president from holding office again. Facebook has moved to put the Cambridge Analytica case behind it. Owner Meta has agreed to pay a massive $725 million to settle the class action lawsuit, but Meta does not admit to any wrongdoing in the matter, says the settlement is in the best interests of its shareholders. Former FTX boss Sam Bankman-Fried is released on bail after he posts a personal bond for $250 million. He will be kept under house arrest at his parents' home in Palo Alto as he awaits trial for 8 federal criminal charges. And with that, it is time for us to wrap up this edition of Business 360. Thanks very much for watching. Stay tuned to the CNBC-TV18 Friday Favorite. The Editors Roundtable will take up the action on the markets and what we should expect going into next week.